Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we help families of critically ill patients in intensive care improving their lives instantly so that they can exercise power, influence decision making, and stay in control of their and their critically ill loved one's destiny, even if they're not a doctor or a nurse in intensive care. In this video, I want to give you the 7 answers to the 7 most frequently asked questions if your loved one is a critically ill patient in intensive care. Welcome to another video in IntensiveCareHotline.com's video series. And once again, congratulations on taking action in getting informed and taking control. Just by doing that, you stand out from the rest of families in intensive care, and it will give you an edge when dealing with the challenges, difficulties and complexities in intensive care. Our video series will help you finding your voice, will help you taking control, power and influence decision making in the jungle of complexities surrounding intensive care. You think you have just lost control over your life. You feel frustrated, out of control, helpless, overwhelmed, challenged, vulnerable, and you feel like other people are making decisions and you feel like other people are driving the bus. Here is what to do about it so that you don't feel helpless but in control of the situation, and so that you feel powerful and influential. This video will help you to get through that difficult and sometimes even traumatic experience when your loved one is critically ill in intensive care. In this video, you will also discover what most families of critically ill patients want to know if their loved one has been admitted to intensive care for critical illness. I have found that in more than 14 years intensive care nursing experience that those 7 questions that are about to follow are the most frequently asked questions that families have if their loved one is critically ill in intensive care. In those 7 most frequently asked questions, you will discover how long your critically ill loved one is meant to stay in intensive care, how many critically ill patients in intensive care survive, how the intensive care unit manages pain for their critically ill patients, what support is available for critically ill patients' families, and what you should do about it, what you need to know and what you need to do if your critically ill loved one is unconscious and or in an induced coma, if your critically ill loved one is going to remember anything about their stay in intensive care, what you need to do if your critically ill loved one shows signs of confusion, delirium or short-term memory loss, what the chances are for your critically ill loved one to fully recover from their critical illness. Now let's start with frequently asked question number 1. How long is my critically ill loved one going to stay in intensive care? Now, here are some facts and figures from the 2010 ANZICS report, where the average length of stay in intensive care in 2010 in Australia and New Zealand ranges from 1.8 days or 43 2-point hours. That's nearly 2 days on average. The average length of stay in intensive care units in the United States of America from 2002 to 2008 was around 4.3 days or 103.9 hours. Now, if you have come to our IntensiveCareHotline.com webpage, chances are that your critically ill loved one does not fall into the above categories. Length of stay in intensive care is generally hard to estimate, and it very much depends on the clinical issues your loved one is facing. The length of stay in intensive care very much depends on the nature of injuries sustained, the type of surgery, or what other conditions or illness your critically ill loved one may face. Furthermore, depending on the nature of injuries, nature of condition, illness, or type of surgery, as well as the nature of any pre-medical history being present, complications may come up that lengthen your critically ill loved one's stay in intensive care. Nevertheless, the intensive care team will ensure that your critically ill loved one will be receiving the right treatment and the right care at the right time in order to maximize your critically ill loved one's chances of a full recovery. Now, why did I say that your critically ill loved one doesn't fit into the above categories of a relatively short average length of stay? Well, the reason I said that is, if you have come to this website and to this video, I would assume your loved one needs a longer stay in intensive care, and that's why you're probably seeking out for help. Now, it's very important that you have trust and you have confidence that things will turn out well. It helps if you stay optimistic and focused. Whilst this is easier said than done, it's crucial and paramount for you and for your family's own sanity, and your positive mindset is often one of the few things that you have total control over whilst your loved one is critically ill in intensive care. Reality sometimes is bleak and harsh, and very often the doctors and nurses in intensive care are telling you the truth when they say that your critically ill loved one has a very poor prognosis. However, even though a lot of treatment is standardized, at least in developed countries around the world, if not very similar almost worldwide, you also need to keep in mind that each case can be very different, and similar cases with similar treatments have different outcomes. Predicted outcomes might deviate from what is expected. Intensive care means dealing with the unexpected and the unknown, often in an instant. That is very often hard to understand and hard to stomach if you are standing on the other end waiting for the good news about your critically ill loved one. Always keep in mind that the people working in intensive care are like fish in water, and that they live and breathe intensive care day in and day out. You and your family, on the other hand, you are like, quote unquote, fish out of water, and therefore you are out of your comfort zone. The intensive care team, on the other hand, are often within their comfort zone. Keep asking questions if you are unsure about anything that happened or is about to happen. Get support. Don't stay in intensive care 24 hours a day. Get all of your family involved. My experience in more than 14 years intensive care nursing experience has shown me that being a family member of a critically ill patient in intensive care is almost as stressful as being a patient in intensive care. You and your family need to look after yourself first. Whilst it is very important for your loved one that you are with him or her whilst in intensive care, it's also critically important for you and your family to take breaks and to not forget that life has to go on regardless. Frequently asked question number 2. Is my loved one going to die in intensive care? Facts and figures from the 2010 ANZICS report. ICU mortality during first intensive care admission is 6.6%, or 7,272 patients out of all admissions to intensive care, which equates to the total admissions to intensive care in 2010 in Australia and New Zealand. Total number of admissions was roughly 110,000. In other countries, such as the United States and the UK, some figures suggest that up to 10% of intensive care patients don't survive their stay in intensive care. Now, those figures basically suggest that patients are dying in intensive care, and it's anywhere between 6 to 10% of patients that eventually will die in intensive care. Now, compared to the overall hospital mortality of 10.2%, meaning how many patients die within hospitals generally, not only in intensive care. No matter how shocked or surprised you are by these figures, they are only figures. Don't get me wrong, if you or your critically ill loved one dies in intensive care, this is serious business. Whether you are young or old, nobody wants to die in intensive care despite of all the efforts of the intensive care team. Once again, whether your critically ill loved one dies in intensive care is dependent on a number of things, and it's rarely black and white. You have to run a few scenarios in your mind. If your critically ill loved one does survive, what are chances of a good and a full recovery and a good quality of life? You and your family might have to think about what your loved one would want, since he or she is often not in a position to decide, and you and your family are the decision makers. This can be a big burden, and once again, try and get support and different points of view before making any decisions. Sometimes, depending on the clinical circumstances, you and your family might be forced to make a decision very quickly, as the circumstances might demand this from you. Furthermore, death is a very scary topic, and society in general is trying to avoid talking about death at all costs. And if they do talk about death, it's very rarely in a civilized or constructive manner. For example, the media trying to sell stories about death. Death just doesn't seem to go well with our perceptions of being fit, young and healthy. But the reality is that death is part of life. The sooner you realize and embrace that death is part of life, the better this will be for you, for your family and for your sanity. I learned that death is part of life in many years of intensive care nursing, because life and death are always part of what we do in intensive care. And in the meantime, I think I can say that I'm not afraid of death, because I have seen it over and over again. Frequently asked question number 3. Is my critically ill loved one in pain whilst in intensive care? Nobody wants to be in pain, and nobody wants to endure either emotional or physical pain. The reality is that unfortunately both emotional and physical pain are part of the journey whilst being a patient in intensive care. Whilst the physical pain can be more attributed with your critically ill loved one, you as the family member or next of kin, you are suffering the emotional pain. Once again, the multidisciplinary team in intensive care will make sure physical pain for your loved one is minimized by administering the appropriate pain medication. There will be times, however, when painkillers might have to be reduced or withdrawn, especially when your critically ill loved one is in a medically induced coma, which is a deep state of unconsciousness. The withdrawal of painkillers helps the doctors and the nurses to determine your critically ill loved one's level of functionality, and also helps your loved one to regain consciousness, as the painkillers might mask the level of functionality and the level of real pain, or it might stop your loved one from waking up and or getting out of the medically induced coma. A medically induced coma is a temporary state your critically ill loved one has been induced to with the aid of intravenous drugs such as sedatives or drugs that put a patient asleep, such as propofol, midazolam, sometimes thiopental, and also opiates, which are painkillers such as morphine, fentanyl or sometimes ketamine. Throughout the medically induced coma, your loved one's critical life functions such as heartbeat and heart rhythm, blood pressure, ventilation, feeding, urine output are constantly monitored and managed by either partly or completely taking over the functionality of those critical life functions. The concept of inducing your loved one into a coma is a very safe option of maintaining critical life functions for your critically ill loved one, and is something intensive care units are doing on a day-to-day basis, and thanks to the specialist skills of the doctors and the nurses in intensive care, it's generally speaking no big deal to manage your critically ill loved one safely. There are, however, rare instances where a patient might be induced into a coma not only to preserve and maintain critical life functionality. There are instances where a patient might not survive the induced coma, usually due to the nature of the critical illness and the nature of injuries sustained. If you are unsure if your loved one is in a medically induced coma, and if you think chances of survival might be low, ask the intensive care team. Frequently asked question number 4. Is there enough support to guide me, my family and my critically ill loved one in intensive care through this very traumatic experience? Generally speaking, intensive care units have gone a long way in the last 10 years in order to improve the support mechanisms for families whose loved ones are in intensive care. Keep in mind, depending on the reason for admission of your critically ill loved one to intensive care, this is very often a traumatic, confronting, sometimes life-changing and very often a once-in-a-lifetime experience. It can be, and it often is, an emotional roller coaster for you, for your family and for your critically ill loved one, especially if the stay in intensive care is a prolonged stay and with an uncertain outcome. The most important thing you need to know is this: your critically ill loved one is in good hands. The nurses, the doctor, the physiotherapists, the respiratory therapists and everybody else involved in your loved one's immediate care are providing the best possible care for your loved one. There are of course limitations in an intensive care environment, but trust me, within that environment your critically ill loved one is safe. In terms of support mechanisms for families who have a loved one in intensive care, there are usually the people who are involved in the immediate care of your critically ill loved one, like the doctors and the nurses, who can answer some of your mainly clinical questions, and they are usually also able to guide you through some of the experience. I'm also very aware of the fact that especially when it comes to a long-term stay of your critically ill loved one, I'm also very aware of the fact that especially when it comes to a long-term stay of your critically ill loved one in intensive care, there may be numerous other issues attached that you and your family have to deal with. Some of the main issues might be spending most of your day and sometimes your night in intensive care to be with your critically ill loved one. That might lead to unhealthy interruptions and irregular eating and sleep pattern. Underage children might have to be looked after by relatives or friends whilst your critically ill loved one is in intensive care and you need to be with them. You might also experience loss of income due to the nature of the hospital stay of your loved one if your loved one is in paid employment. You may experience loss of income if your loved one is running a business. You may experience loss of income after paid time has been taken off work for yourself or one of your family members if your loved one continues to stay in hospital or in intensive care and if you want and you need time to stay with your loved one. You might experience long traveling times for you and for your family depending on where you live and which hospital you have to travel to. Sometimes interstate travel and a hotel, B&B or other alternative accommodation costs add up to the list of expenses. Car parking expenses, as car parking, especially in inner city hospitals, can be very expensive. You might also be unable to access bank accounts and funds of your loved one, as bank accounts sometimes might not be in joint names. The list could probably go on and is certainly not exhaustive, but this is what I have found are the most common and urgent problems you might face if your loved one is critically ill in intensive care. Usually what happens, especially with social, financial and legal issues, a social worker will make contact with you. You may have to ask for it, but do not hesitate to do so if you feel like you need help and support. Try not to be a hero. This is a very traumatic and difficult time in your life, and you might not be able to, and neither should you, carry all the weight of the responsibilities by yourself. Get help. Keep looking after yourself, as this is just as important for the recovery of your loved one as it is for your own health, well-being, and most of all, your sanity. Frequently asked question number 5. If my critically ill loved one is unconscious or in a medically induced coma, will he or she still remember or feel that I am there with him or her? This is a question I encounter all the time. The answer? Well, your critically ill loved one is unlikely to remember any details whilst being critically ill in intensive care. Part of this amnesia or memory loss is obviously the comatose, semi-comatose condition or the general drowsiness of critically ill patients in intensive care. Some or even most patients in intensive care do not remember any details of their stay, and they do remember episodes of their stay, and they often report remembering their loved ones talking to them and being with them during a critical time in their lives, even though they do not remember the exact details of conversations. As pointed out in question number 4 of the report, I do not recommend for you to stay in intensive care 24 hours a day, but I do strongly recommend for you and for your family to spend as much time with your loved one as you think is appropriate for him or for her in order to get the best possible recovery with your and your family's support. Frequently asked question number 6. What if my loved one is confused, drowsy, or what if he or she has lost their short-term memory? You might find that once your loved one has come out of the induced coma, he or she might go through a phase of drowsiness, confusion, and agitation, or if your critically ill loved one has a severe head injury, the condition is usually described as a PTA or a post-traumatic amnesia. During this often temporary phase, you might see a distinct personality change in your loved one. Personality traits might have changed distinctly, and this may present itself in abnormal, disruptive behavior such as aggressiveness, disorientation, cursing, inability to follow simple instructions, and the list could go on. Whilst I have found that this pattern of unusual and disruptive behavior might cause some distress for you and for your family, as you might see some personality traits of your loved one you wish you may not have seen, it is very important for you and for your family to put this unusual behavior into context and into perspective, and you may have to accept this behavior as being temporary and also being triggered by the therapy, treatment, and nature of the illness or injury. This unusual behavior can also be attributed to the side effects of the intensive care therapy, such as sedatives, opiates, and other drugs given. You might also feel like nurses and doctors put up with verbal abuse, sometimes dealing with a level of confusion and aggressiveness from your loved one that has previously been unknown. Nurses and doctors in intensive care are able to put this unusual behavior into context and into perspective, and most of the time they are able to deal with it very professionally and in a mature way. They don't take it personally. So stop apologizing for your loved one. Your loved one will not remember any of it. Frequently asked question number 7. What happens after my critically ill loved one will get out of intensive care? Will he or she fully recover? Chances are that if your critically ill loved one survives intensive care, a partial or full recovery is possible. Having said that, it obviously depends on a number of factors, such as the reasons for admission to intensive care, age, pre-medical history, support mechanisms and support systems, intrinsic resources, for example, how does your loved one deal with crisis and adversity, general resilience, outlook on life, for example, is the glass half full or half empty, and the list could probably go on. And one may have to look at the individual in order to determine other factors. The reality also is that a full recovery after a prolonged stay in intensive care might take time, and here I am talking about the physical as well as the psychological and emotional recovery. Both might take time. Give it time. Reflect. You may find that you, your family and your loved one come out much stronger at the other end. You may find that the things you used to worry about in the past do not worry you any longer, as the experience in intensive care has shown you that life is a precious gift that must not be wasted and that must be lived to the fullest. Whilst writing these last lines of the report, it reminds me of a quote that I have read recently, and it moved me deeply, and it made me aware of the limitations we all face one way or another. It goes like this: death twitches on my ears. Live, he says, I'm coming. Your loved one might go on to rehabilitation after the intensive care stay and after the hospital stay, so give it time. The other issue I would like to shed some light on is that intensive care health professionals, whether doctors or nurses, are not the best people to ask to how well your critically ill loved one is going to recover outside of intensive care. The intensive care team are the experts at what is happening in intensive care, but they are not experts outside of intensive care. Therefore, keep in mind that whatever the doctors and nurses may tell you, as soon as your critically ill loved one is leaving intensive care, they often have no idea what is happening from there on. Keep in mind that the intensive care staff's goal is to keep your critically ill loved one alive and then to get them out of intensive care. That's what they are the experts on. I really hope that this video has served you well, and I hope that it answered some of your questions already. For more information on a variety of topics within intensive care, check out more of our videos, ebooks and audios, and also read our blog for more tips and strategies, and also check out your questions answered section. Find the links in the written version of this video. You can also send me an email to support@intensivecarehotline.com if you have more questions, and I'll answer your questions personally. I hope you've enjoyed this video, and I'll see you in the next video. This is Patrick Hutzel from intensivecarehotline.com, and thank you for watching this video.